MidState family, I'm Kelsey, one of the MAs at MidState. I'm here to talk to you a little bit about wound care. You might find yourself leaving with a wound left from a biopsy, a regular shave biopsy or a punch biopsy, an excision to remove a skin cancer, an ED&C, which is electrodesiccation and curettage, or cryotherapy, which is just the liquid nitrogen. So you will definitely leave with written instructions no matter what, and you can always call us with any questions. We're just going to walk you through how you will care for a regular excision today with fake stitches on an arm. So when we do an excision, we most of the time can close it just side by side, so you'll have a nice straight line of stitches. So essentially, wound care is not hard at all. What we'll be doing is just basically doing a once a day dressing change. So we'll just clean it. This is just a little bit of saline, but you'll just basically clean it, wipe over the stitches, just however you're comfortable. You can also just clean it with hot soapy water in the shower. And then you will run over those sutures with Vaseline or Aquaphor, or CeraVe healing ointment. It's all the same. We just like plain old Vaseline most of the time. We just want to keep all that dried blood and crust off of the suture line and just keep them clean and gooey. Then we advise you to use a non-stick Telfa pad. This is what the packet looks like. You can get them anywhere over the counter. This is just a bigger one. And you'll just place that right over the sutures. So you'll just place gauze over that Telfa pad. Most of the time, a little oozing from your suture line, a little bleeding is normal. So we advise you to just, most of the time we do a little pressure dressing on the day of, and then, you know, it's normal to ooze a couple days after. So just fold that gauze up, however, to make sure the bleeding doesn't come through, and just to hold pressure that first day. And then you can either tape it down and or wrap some Coban. If it's an arm, if it's on the chest, you can't use Coban. You would just wrap the Coban. When I tell people to wrap with Coban, instead of pulling tight around the arm, cutting off the circulation, I always hold it here and stretch it and then let it go and wrap it so that it has room to move and you're not cutting off the circulation. And then it just tears. If you have an excision, it's also possible that you could leave with staples if the excision were done on your back where the skin is really tight and it's hard to stay together. Staples are not super common, but it's possible, and you would just take care of it the same way, just once a day dressing change, Vaseline, and a bandage. So other ways that you would leave our office with a wound, less invasive procedures. A shave biopsy is super common with our office. It's how we detect a lot of skin cancer, or a biopsy for anything. You would basically leave with just a little scrape of the surface of the skin. We break the skin, but normally it really doesn't bleed that much. There's not a whole lot of wound care besides just keeping it clean. You can just let hot soapy water run over it in the shower, or just clean it with just water. And there's no stitches, so no need to clean the suture line. You can just apply Vaseline, Aquaphor, CeraVe healing ointment, and a bandage, and it should heal in about 2 weeks. Another form of biopsy that we do is a punch biopsy. Just for example, it's basically like a little cookie cutter. We just take a little piece of the skin and we just go deeper so we can get more testing on it. If we do a punch biopsy, a lot of the times we have to put a couple stitches in, just usually 1 to 2 to bring together the skin. In that case, you would just treat it just basically like the excision wound care. You would just keep it clean, keep those couple stitches covered up with Vaseline and a Band-Aid. A lot of the times we do treat superficial skin cancers with a treatment called an ED&C, electrodesiccation and curettage. And basically we would just use a small curette that's pretty sharp and just kind of scrape and cauterize a few times onto the skin. We are breaking the skin, creating a little wound. But the good thing is there's no bleeding because it's cauterized. You'll just have like a little wound there, no stitches involved, and just keep it clean, keep it covered with Vaseline and Band-Aid, and it'll heal right over with a little scar in its place. So if you visited our office, you've most likely had cryotherapy treatment done. This is used for a number of things like warts, even superficial skin cancers, precancers, several things. And basically when we spray you with liquid nitrogen, it's like a cold burn. It does not break the skin at all. Most likely it will crust up and blow up like a little mosquito bite. It'll get red and puffy, it may blister, and it'll crust up and flake off in 1 to 2 weeks. So with all of the treatments that we do that would leave you with a wound from MidState, you can take Tylenol for the pain. The pain will not be excessive, but for the first couple of days, Tylenol is okay. If you have an excision or, like I said, the punch biopsy with 1 or 2 little stitches, you will get those stitches out in 1 to 2 weeks depending. And at that time, everything should be pretty much healed up. Most of the time with excisions, we do stitches on the inside and the outside. The inside stitches dissolve on their own, the outside stitches come out. And the skin should be healed over pretty much the same with staples, even when they come out. So it is normal for your excision site to be red. It's normal for it to have irritation. It's gonna be sore. It's gonna be a little painful. It is normal to have a little yellow film over the area. That doesn't mean that it's pus and it's oozing super bad. If there's a little yellow film, that is normal. Your excision site should not have redness extending past 1 to 2 centimeters margin around it. If you do see redness extending pretty far, or warmness in the area, or of course if it won't stop bleeding, then just call our office and we can usually get you in to be seen and have it checked. Well, thanks for listening. As always, if you have questions about your wound, concerned, or just really want to talk it over with your provider, please feel free to give us a call at any time and we can talk to you over the phone. We also have the option for you to send us a photo so you don't have to come in, or of course you could come in. Bye!